Hi everybody, this is Dr. Pulmatrud and I want to talk about the cerclage. What is the meaning of the cerclage? During the pregnancy, when there is the threat of the preterm labor, especially in the early phase of the second trimester, which is about the 14 weeks to the 16 or 18, when the cervix start to be short and we see the shortness in the cervical length, we do the cerclage. During the cerclage, we use a special thread and close the cervix as far as we can, and it helps the pregnant women to pass the pregnancy until the end of the pregnancy, or maybe a few weeks before the termination. All of the women or of the pregnant women don't need to do cerclage. In some pregnant women with the past history of preterm labor without pain and about more than 18 weeks of the pregnancy, we recommend to do cerclage. And some pregnant which may be prone to the preterm labor, we checked their cervical length in the ultrasound, serial ultrasound, and when we see the cervix is starting to be short and shorter, so we recommend the patient to do the cerclage. Sometimes the cerclage is very high risk because the membrane or the in the cervical canal, and the patients are prone to rupture of the membrane, uterus membrane of the fetus, which is a very bad outcome in pregnancy. So cerclage is a risky operation, but when it is necessary, physician do it. Moreover than it, in some patients, cerclage isn't the only solution. We can sometimes put pessaring in the vaginal, and also recommend to use the progestin suppository or another kind of progestin injectable during the pregnancy. And before going to the labor process or doing a cesarean section, we put out the cerclage thread by a very easy and simple vaginal exam. And the most important thing is the check of the cervical length in the serial sonography. As you know, the uterus is a place for pregnancy, and there is a door for the uterus or womb, which is called the cervix. And cervix has a length and about 3 to 5, sometimes 6 centimeter, and it has 2 opening orifice, one opening in the above in the uterus, and one opening in the vaginal, which is called external os. And the distance between the external os and internal os is called cervical canal, and which we are measured during the serial sonography is the cervical length. And according to the cervical length, we decide to do the cerclage or not. Sometimes there is a late onset shortening in the cervical canal, which produce more risky situation for the patients and the fetus, and sometimes there is no way to do cerclage in some patients, and just with complete bed rest and using progestin we can continue the pregnancy more and more. I hope you find this information about the cerclage operation useful.